Let's talk about
sex.
Ed.
We at Conwy Youth Council devised a survey about sexual health education and provision in conjunction with the Conwy Sexual Health Task Group. The survey included questions covering a number of themes which included sexual health education, information on sexual health, contraception and interaction with professionals. The survey was sent out to all secondary schools and colleges in Conwy and we received over 500 responses.
Information. We asked a number of questions about how young people get information on sexual health. It was evident that most young people prefer to get information about sexual health from lessons in school or college. The second and third most popular choices were via leaflets and online, with these being chosen because they are convenient and anonymous. We also asked young people how they knew if the information they received about sexual health is trustworthy and up to date. 65% of young people made a conscious decision about what sources to trust. However, 35% of young people were reckless or uninformed.
Contraception. Young people in Conwy told us that access to sexual health advice and contraception is important to them. 65% of young people preferred to get advice, condoms and emergency contraception from health services, and 33% from education services, as opposed to a situation with no opportunity for consultation and advice.
Confidentiality. Despite young people preferring to get advice, condoms and emergency contraception from health services and education, approximately 2/3 of young people in the survey had worries about confidentiality. One young person puts it like this: "It doesn't matter as long as everything is super confidential." So to help tackle the core concerns that young people have about confidentiality when seeing medical professionals, we designed this poster to distribute around GPs, surgeries, schools and pharmacies.
Ta-da!
Education. Only half of the young people who took part in the survey said that they had received sexual education. We understood that this may not be a reflection of reality within the schools. However, the following reasons may be given for why young people say they have not received sex education. They may not recognise that a science lesson about the reproductive system is sex education. Only 1% of those taking part said that their science teacher had given them sexual education in lessons. If sex education is given as a one-off during an enrichment day, a young person absent on that day will not have received it. Of those who have received sex education, 37% said it was useful, however 20% said it was not useful. We also asked young people if there was anything they would like to add to sex education lessons. Following really useful ideas came out: use of real-life case studies, providing advice on how to deal with the emotional side, providing information on how to stay safe, providing information on how to deal with the consequences, use more positive messages and provide advice for LGBTQA+.
Some common themes related to sexual health education also came out. These were: provide ongoing sexual health education as opposed to a one-off session, provide education about relationships as well as the physical mechanics, provide education for people of various sexual orientations. Education needs to respond to current issues such as trends and messages being portrayed throughout the media or films. So in summary, the survey suggests that young people think that sexual health education in schools needs to be more positive and cover relationships, be made less cringeworthy, take place over a longer period of time in smaller doses, and needs to reflect the diversity of young people.